To know. One thing that we have learned is that we can't predict what's going to happen, and we are reacting to what has happened over the 2 weeks, 3 weeks, particularly since that July 1st week. So we're past that first incubation period. We're starting to see people getting sick in the second incubation period, and this is the second generation of transmission from events that happened over the last 3 weeks. So we don't know. We know that there are people who have been exposed, and there's several hundred of them now who are in all health authorities in BC. Many of them were connected to Kelowna. They've gone back to where they lived, either in Fraser or Island or other places, and some of them will get sick. So we'll see more cases in the next couple of weeks. But the challenge and what we can do is stop those people from exposing anybody else. And that's where we are right now. We are at a bit of a tipping point. We now have started to see cases increase. Our curve is bending up. We know what we need to do to flatten it again. And that is make sure that if we are exposed, that we stay away from others until we're through that incubation period. Get tested if we have any symptoms at all, or if we've had a high-risk exposure. You know, even if you're uncertain about whether you're feeling exactly well or not, and you've been at one of these parties where you know people have been sick, it's okay. We will test you. But you still need to stay away from others during the incubation period. Now we can contain this, but we need people to be aware of it and to take those prevention measures that will stop that next party from happening where somebody inadvertently brings it in and another group of people become ill. We need to do that now, because we know the more people get ill, the more chances even young people will have severe illness, will end up in hospital, and unfortunately some people will die. We also know that young people work, and we have families, and we have other connections in our lives, and we will get spillover, as we have seen in the past, either into hospitals, into long-term care homes, into other areas where other people at risk may be. And that's what we need to prevent now, and we have the means. We know how to do it here in BC, and we can do it.
Do you have a follow-up, Lisa?
Yes, one of the things I noticed in the responses to the survey was it was around 70% people saying they were able to stay home when sick, but it was 10% less than that of people saying they were actually staying home when sick. That seems concerning, and I'm wondering, do you think that the message isn't getting out there? Was this earlier when people were worried they weren't going to get paid? I'm just wondering what is being missed there, because you've mentioned many times that that is key to us staying low and slow, as you put it.
Yeah, I think it's a combination of things. So it talks about people's agency and ability. So part of it is physical ability. Do I have a home to stay in if I become ill? Or what is my living situation that allows me to do that? And the other part of it is, do I have a sick leave? Am I allowed to stay away from work if I'm sick? What is the culture in the place that I'm working? What am I going to do if I don't work and I don't have an income? So it's addressing all of those, and I think one of the important things that we recognized early on, and the Premier advocated nationally for, was making sure that at least during this period we give people the means to be able to stay away from work if they're sick, and that's having sick leave for everybody supported. That's really important, because we heard that over and over again. There's also a culture in many places, and in healthcare more than many other places, of presenteeism. If I don't go into work, it's going to overburden my colleagues, and we minimize our symptoms and say, oh, well, it'll be nothing. And we've seen that happen, and that's a challenging thing too. So we need awareness and increased awareness for people to stay home.